The next time you're working with a patient that has tight glutes or a tight piriformis, I want you to not stretch them. I know that might sound crazy as that's usually the normal treatment, but what I want to do in this video is share my thought process and strategies as to how we can really improve mobility without stretching. So if you stopped this video and typed in how to fix tight glutes or tight piriformis or how to improve sciatica symptoms, a lot of times you're going to find the same solution. And that solution is stretching. So you can think of your classic piriformis stretch, glute stretches, anything that's going to open up the hips. Now, although this does have a place at a very specific time, it really neglects one key aspect to the problem. That one key aspect is position. Usually the position that the pelvis is in creates the tightness of the piriformis or the glute, which causes the problem. So when we don't address the position and we just stretch the patient in their current position, we essentially are going to start to create more and more stiffness. Sure, they may feel a short-term gain or short-term relief, but long term, we are going to push them and drive them more into a position that is causing their problem to begin with.
And so we can better understand how the position drives this dysfunction by looking at the pelvis. And what I did is I threw a band on here to represent the piriformis running from the anterior aspect of the sacrum around to the front of the femur. And when we're considering a tight muscle, we need to start to change our language. Instead of saying tight, we need to think of a tight muscle is going to have a compressed space, right? So if there's a compressed area, the muscle really has no choice but to be tight. And the opposite can be true as well. And that is when there's an open and expanded area, then the muscle is going to be more elongated and more able to freely flow, right? So if we can think about compressed and expansion, it helps us attack more of the source of the problem compared to just talking about symptoms. Now, positionally here, if we have a left piriformis and left glute, that is the problem. That is the tighter side on our patient. We already said that that area is going to be compressed, right? Well, if we have compression on one side and don't have the compression on the opposite side, that is going to have a direct response on the pelvis. That is going to start to turn the pelvis to the right. We're going to get compression on the left side, aka tight piriformis, tight glutes, and we're going to have expansion on the right side and a normal piriformis and normal glutes. So here's the thing. You can see how when we turn, notice how this outlet here opens up and this area is compressed. I know my hand's blocking a little bit, but I want you to really recognize how much open and expansionness we get here compared to the compression at the left. So if we stay in this position and then we just go and stretch the femur and move into a classic piriformis stretch, can you see how that doesn't change anything here? So yeah, you might get a little bit of length on the tissue, but we're not changing the position. And so this is why so many people continue to stretch and stretch and stretch and don't get relief, because they're stretching in a dysfunctional position. And they're ultimately teaching their body how to get better or more mobile at staying in that position. So now that you can kind of visualize this, to really fix the source of tight glutes and a tight piriformis, we need to change the position. The really nice part is when we change positions, aka when we start to shift and do the opposite motion, we start to open up and elongate, we're essentially stretching, right? But now we're actually opening and expanding an area and allowing the muscle to naturally stretch through that. That's when patients really truly can learn how to reciprocate the pelvis and move the pelvis and start to get out of chronic tight muscles and be in a position that allows the muscles to move as they should. So now that we visually understand the true source of the problem, I want to go over 4 exercises that I like to use to improve mobility for tight piriformis and tight glutes. But before I do that, I just want to bring it back the reminder that your execution should always align with your intent. That means that the exercises that you choose should align with your intent. Now, these 4 exercises have the same intent. That intent is to open up the posterior lower pelvis so that we can improve the mobility of the piriformis and the glutes in a way that provides long-term relief. So our execution is going to be hip shifting exercises, right? Because when we shift back on the left, we're opening up and elongating that space. So I just wanted to make that apparent as we go through these 4 exercises. So the first exercise I like to start with is a wall hip shift. Now, this is a really basic exercise when it comes to execution, but it provides a ton of value and a ton of education to the patient. So I encourage you to start with this one before doing the other exercises, just because this is going to really teach them how to move properly. All right, so I'll go through all the key aspects once we go down into the position. What you'll need is a wall, a foam roller, and something that the patient can rest their head on. This sometimes works, but sometimes with the patient's arms and their structure, it still puts their head at a very tilted position. So make sure we can get a neutral neck. That way everything's staying relaxed. All right. So let's start at the feet and work our way up so you can really understand the why behind this movement. So we're purposely on a wall. Once we have foot contact, it turns more to a closed chain exercise, right? So the primary mover becomes the pelvis and not the femur. So make sure both feet have contact on the wall, and it's even better, as you'll notice, without shoes. That way you can actually sense the wall. Next, we have a foam roller. The foam roller is a really important part. The foam roller is cylindrical, so it really allows for rotation to occur. Here's the cool thing about it. When the patient goes to do a hip shift where they're pulling back, the requirement is that they need to see the foam roller spin. This is really important because a lot of times patients will think that they are hip shifting, but really they're going into an anterior tilt. So as you can see right now, I'm moving my pelvis through an anterior and a posterior tilt. The foam roller is not moving at all. So if you don't have this foam roller, it can make it hard for you to see, but make it really easy for them to think that they're doing it correctly because they feel motion, but it's not the hip shift that we're looking for. Remember, the hip shift is crucial because we're trying to pull back to elongate and expand the posterior pelvis, right? So as we go through it, it's very straightforward. We're starting in a stacked position. Make sure that we're not open because that makes it really easy for them just to turn their body and not turn their pelvis. But from there, it's just pulling back, right? We're going to stay in a nice neutral position at the pelvis. We're going to pull the left knee back, and we're going to visually see the left knee behind the right. Now they should start to feel a stretch or muscle activity on this back posterior capsule, posterior pelvis, and then they're just going forward. Again, it's a very basic exercise, but it starts to teach them how do we do a pullback without turning our spine, because that is super common. They're going to try to turn back. So you could have them reach here if that helps. And so how do we do it without going into a crazy anterior pelvic tilt? And we know if we do it right based off the spin of the foam roller, right? And that's all we're looking for. We can hold it back here. We can go through bigger range of motions. We can go through smaller. You can do whatever your patient needs, but this is a great starting point to get them to truly understand the mechanics of hip shifting. So the next exercise I like to do is the foam roller piriformis stretch. Now, I already know what you're thinking. In the beginning of the video, I said I do not like doing the piriformis stretch, right? Well, here's the thing. The foam roller, it allows a lot more influence on the pelvis. Specifically, rotation where we're shifting the left back. So that's why I like doing it. It's a little bit more of a dynamic stretch with more of a pelvic influence. Now, I always start this exercise by prefacing to the patient that it's okay if your knee cannot lay flat on the foam roller. This position could be vulnerable for a knee if someone is dealing with either knee pain and or previous experience of knee pain. So something to consider. And if it's too intense, because it is more on the intense side, you can always work your way up, go onto boxes or a bench. This is going to be really the most intense because it's pretty close to the ground. It allows for rotation, but you can still get that pelvic influence from a bench or a box if it's needed, right? So all we're doing is throwing the side that is tighter. So we said the left side was. We're going to throw that up. And what we're looking for is the knee to come down if it can, and the foot to be in a straight line. So if someone has really tight hamstrings, they're going to have really struggled to keep this foot on. It's going to try to go into more of a knee flex position. So from here, all we're doing is we're going to start with our right knee close. We're going to back that up and bring it in. That's really going to wind up that piriformis and that hip. From here, all we're doing is working on drawing that left hip back. So notice how I'm pulling that left back. I'm not just turning my trunk, I'm actually really pulling back. And so this is nice because we can push forward if we want, but we're pulling back that left pocket and pulling it forward. So we're working on the left hip shift as we go through this and winding up that left piriformis. The next exercise I do is the bent over hip opener. This is a really good one. It looks fairly simple, but it's actually pretty intense. Again, the goal is shifting the pelvis to the left to open up the posterior pelvis. All we're going to do is instruct the patient to be down in a bent over position where your arms are about at hip level. If we're too high, it's not really going to be the best. And if we're too low, it's not going to be the best. So about hip level as far as the height of the table or the bench or the desk, whatever they have available to them. Once we're in this position, because the left side is the side we're working on, we're going to keep the left foot down. We want to line up where the ankle remains right under the knee. So we don't want to be super far forward or super far back, kind of at that midpoint. And then all we're doing from there is kicking this right leg back. We're going to make sure the head's nice and relaxed. We are going to use the pelvis to turn. So we're going to open up. We're going to keep this leg fairly straight on the right side. We're going to open up, and then we're going to draw down. Now, the easiest cue for this is right pocket down, left pocket back, right? This is the hip shift component. And once we're in the end range position, meaning I can't drop my right pocket back anymore, I'm then going to really work to bring that thigh up. If they're feeling a ton of calf, that means that they've shifted forward. All you need to do is shift them back. And as I go and shift back, I can feel that tension ease off my calf and get more hamstring and glute. And then you would just repeat. They would come back up, and then they'd really work on coming back down, make sure they didn't shift forward, and we're seeing how far back can this left pocket go, how far down can the right pocket go, and then how high can we get that right quad. Again, the main goal of this, what we're doing is shifting to that left side to really stretch and elongate the piriformis and the glutes. So the last exercise is the most dynamic, strength and performance based of them all. However, the principles remains the exact same compared to the previous three. That is hip shifting to the left to get and create expansion at the posterior lower pelvis to improve the mobility of the piriformis and the glutes, right? You can start to see how you can really start to link up performance-based stuff to improve mobility, right? So it gets pretty cool. So what we're doing is a split stance deadlift. I have a slant board here, and we're gonna go in a toes elevated position. Toes elevation is going to increase dorsiflexion, promote more internal rotation bias on the left side, which is going to help us turn and shift the left hip back. Now, if you really want to dive deep in understanding modifications and all these principles in a lot more detail, I do want to take a second to let you know about our Performance Redefined course. It is an online self-paced course that really redefines how you coach exercise, and specifically how we can start to improve mobility while performing performance and strength-based exercises. So it's really great for PT students, physical therapists, sports physical therapists, strength conditioning coaches, anyone that really wants to take their coaching to a next level and really understand the why behind their coaching. So I'll leave that in the link below and feel free to check that out. Now, back to what we're talking about here. Again, we are looking at hip shifting. So we're going to go with the left foot up. We're going to have a weight. You don't need it if you don't want, and a ball between the knees to help continue, like we talked about in exercise 1, this shifting mechanics, right? So all you'll do is we're going to put the ball between the knees. We're going to go in a toes elevated position. We're going to throw the right foot in front. So we're already turned and shifted into that hip. And then from here, all we're going to do is push the right knee forward as I'm pulling the left hip back. So I'm rolling the ball. And I like to coach patients that the kettlebell in this instinct is going towards that left big toe. I'm feeling this left glute, left hamstring, and then I'm coming up. So again, notice I'm still shifting to the left, and that's the main goal. Now we're just doing it and challenging the strength, and we can continue to build on this as the patient gets better and better.